As we near the end of 2022, it's a great time to talk about what's new, now, and next at Altru. I'm Annie Bonzer, and today I'm here with Todd Forkel, our CEO, and Dr. Josh Deere, Altru's new president, and we are on site at Altru's new hospital construction site. Todd, when you come on site, what excites you about this?
The day when the people who come and are served here will get to have care in this wonderful facility, and our staff for the day as they come in, for the magic that'll happen when they are inside the four walls of this facility.
Very good. Dr. Deere, I hear that you were born in our current hospital.
That's correct.
And soon you're going to work in our new hospital.
Also correct.
How does that make you feel?
Yeah, makes me feel a little old, I would say, but really excited to be able to be part of this project. It's a huge step for our community and an investment that Altru is doing for our greater Grand Forks area as well as our region. So excited.
Awesome. Me too. Well, I have plenty more questions for you too, but how about we take a look inside this place?
Awesome.
Thanks.
Okay, here we are. Dr. Deere, can you tell us where we are in the hospital right now and any key highlights about this space?
Yeah, we're on our second level and we're out in the patient aftercare unit, which is where patients after surgery will be coming to recover. This space is large and expansive and unique versus what you're seeing behind us. One unique feature is all along the outside of our hospital here. You'll see a corridor that's for patients only, with our staff and everyone kind of on the interior. So what we like to call on-stage, off-stage, with easy wayfinding for families and patients.
Todd, what is one thing patients and families will notice when they enter our new hospital?
Wide spaces and great flow that will not only benefit them and the kind of care we can give, but also our staff. I think also with the way the structure is, there'll be a ton of natural lighting, and we know there's a strong connection between light and healing. And so we feel like the culmination of all those things are going to bring about world-class experience.
Dr. Deere, can you talk about some of the improvements in terms of privacy in the new hospital?
Our new emergency room is going to be a big game changer for our community and our region. Almost exclusively private rooms, which will make it great for privacy of care delivered at the bedside, and ease of flow. All throughout our hospital, we're going to have private rooms, which will include our NICU, which is also a change, our neonatal intensive care unit for those that are unaware what that stands for. But those will also be private rooms, which will be very different for those families.
With inflation affecting everyone's pocketbooks, are we also feeling a pinch?
Yes, Annie, like every project across the country and really every household across the country, we are facing the impacts of supply chain disruption, and just overall inflationary costs have impacted our project. What was once a $400 million project, we're right around a working budget of $470 million.
Dr. Deere, we just celebrated our topping off ceremony. What's the next big milestone we can look forward to?
I think the next big milestone will be having this all enclosed. So all the workers we see here as you drive by day to day will be able to finish and start working on the inside. As you can see, it's not done. There is areas behind us that look fairly finished to me, but that's what we'll see next.
Okay, now feels like a good time for some rapid fire questions on a few other topics. Dr. Deere, how is the newly renovated Altru Rehabilitation Hospital benefiting our patients?
Yeah, our Encompass Health joint venture that's part of Altru is really expanding the opportunity for our patients to get to rehab potentially a little bit faster, and utilizing our community and critical access hospitals to get patients closer to home to do rehab closer to their families. We went from a prior census of about 8, and we're pushing near 30 now.
Todd, how can partnering with UHS for behavioral health help our community?
Our partnership with UHS brings the best of both worlds. UHS is a national leader in the space of behavioral health. And with our providers and staff and our brand of world-class care, marrying that together will bring a better product to what we know is a great need in our community. And so that partnership will meet unfortunately, a growing demand for services.
Dr. Deere, from a primary care perspective, why is a focus on behavioral health so important?
Well, I think a focus on behavioral health is very important given the fact that as a primary care provider, I'm seeing more and more depression, anxiety, bipolar disorder, PTSD than I've ever treated in my career. And the opportunity to expand services is something that's really drastically needed for our region.
Altru has received many awards this year, from Newsweek's Best Maternity Hospital to Prairie Business 50 Best Places to Work. What does this mean to you?
Awards are great. They recognize the great work that people do. But what it really exemplifies is the end product, is that we're here for people when they need us, and they're going to get taken care of very well.
Name an Altru employee who consistently brightens your day.
So the employee that's brightened my day the most today is Chris, because he saved us from this boom.
Yeah.
Thanks.
Take a bow.
And he's building this building, which is awesome. So thank you, Chris. Okay. I'd say my nurse, Heather, given the fact that I've taken on a variety of roles over the years, she's been a rock for our patients and even me, and always has a positive attitude for those that know her.
Todd, what is Altru's vision as we move forward?
Our vision as we move forward is to be world-class in everything we do. World-class in being the best place to work, and world-class in being the best place to come to for care.
Yep.
Boom drop.
Yeah.
You're supposed to drop it now.
No, I don't get in. Todd's a closer.
I got to close.
Okay. At least.
Good.
All right. Whoa.